Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn the drugs and the test. So, heparin, lepivudin, lepirudin, bivalirudin, argatroban. The test is aPTT. You should do aPTT for them. Then, if you give the patient with warfarin, argatroban, then you should do prothrombin time should be done. And then drugs like low molecular weight heparin, like enoxaparin, enoxaparin and tinzaparin, and drugs like apixaban, rivaroxaban, and cimelagutran, dabigatran, and fondaparinux. In this, you do not need to do any test. Thank you for watching.
Thank you and thank you for watching.